So one of the things is with medicine, it is incredibly competitive. Yep. And it is quite selective. So you need to find the right program to get you to the course that you want. Remembering that in 2019 there will only be 7,500 spaces in the UK for medical students. There is around an 80% rejection rate going from A-level to medical school in the UK. Partly because students within those streams are competing with other UK students, and partly because that is the mainstream normal program which most people take to get to medical school. But for international students, especially Korean students coming from high school, the foundation program is available and does get students to selected universities. We work with University of Central Lancashire, Royal College of Surgeons Island, and St George's in the Caribbean. And for example, out of the students we took from Korea last year, we had 100% success rate in getting those students to university from the foundation. And overall, in the total number of students we took from the foundation to the university, we had, Houston, was it 80%? 80% success rate.
100%.
One of the reasons for that success is essentially the students are doing an MBBS pre-foundation course. It's a foundation course specifically designed to get students to MBBS or medical school. So what that means is they're focused only on what they need to know for the progression. Whereas an A-level student will be doing biology, chemistry, maths, and it is a little bit more general because they can use those courses to apply to anything around the UK. So for an international student who probably knows quite a bit of this already, they're also a lot more motivated in terms of the students on this course because they actually get to use some of the facilities in the medical school. They're actually there where they will be doing the MBBS. They get to meet the people who will interview them, so they're a lot calmer. They understand what's going to be asked of them. And in UCLan's case, where they study, it is a medical school which was initially set up specifically to cater for international students. So they are very good at dealing with the sensitivities around difficulties coming through that. Will there be the possibility to work afterwards? Yes, there is the possibility because there is a new setup in the UK where the UK needs doctors. So there will be job opportunities in the UK, and also we can provide job opportunities in the USA through another pathway there. So it's very flexible in terms of that. One of the things with the foundation that you need to remember is the interview is guaranteed. Yep. As soon as you get on the foundation, that interview is guaranteed. It's not guaranteed if you're going through an A-level route. Yep. You have to be selected and called for interview. So that's the advantage that you get through this kind of foundation. We're still selecting you on the interview. If you pass your IELTS, if you pass your academics, and you pass the interview, you have a place. So that would be in terms of the security within it. There's nothing wrong with A-levels. It is a good route. We have students who do 1 year of A-levels, then come and do our foundation. Absolutely fine. Just for students, especially Korean students from year 12, it does save time as well. Yep, because it is 1 year instead of 2 years. And some people will talk to you about what's called the fast track A-level, where you can do in 1 year. You'll still have to do 2 years of work in 1 year, and given there is an 80% rejection rate for medical school, doing 2 years of work in 1 year, you're risking failure. So the foundation is a lot more focused, especially for year 12 students from Korea. If your question to me is which is better, it really depends on who it is for. If you're a student who is slightly older, the foundation. If you are looking for your son or daughter who is 15 now, yep, you have a long way to consider. But the A-level route may be slightly stronger in terms of that. But then they can always redecide later and do the foundation after the first year of A-level. They're both good routes. No route is better. Yep. 10 years ago, only A-levels. But now the UK is slightly more flexible in terms of different programs, and they are equally as good. Equally as good, but it really depends on the profile of student, which one is better suited to get them in. And remember, 80% of all medical applicants are rejected. There are only 7,500 spaces, so you need to find the program which is best for the student to stand the best chance of being in the 20% of students that are accepted.